A 28-year-old female teacher presents to the clinic with history of lower abdominal pain. Now, this pain has been progressive for the last 2 years. It has been increasing in intensity, especially during menses. She also reports that she has been trying to get to conceive for the last 2 years, but she has not been successful despite the fact that she has been having regular sexual contact. What do you think this patient might be suffering from? Hello and welcome back. My name is Joseph Tsuma, always your favorite doctor, and when you see me here, you know it is Mother's Health. I'm here to bring you trusted health information wherever you are. You can follow us, you can follow me for simple, updated, practical, and reliable medical insight that should be able to keep you and your family healthy. You can also subscribe to my YouTube channel at Dr. on Wheels. You can also follow me on TikTok at Dr. Itsuma. So today I want us to discuss endometriosis. But before we dive into today's topic, I want us to listen to some words of wisdom from the book of John, chapter 14, verse 1. And Jesus said, "Do not let your heart be troubled. You believe in God, also believe in me." So let us dive into today's topic. So what is endometriosis? Endometriosis is a chronic gynecological condition where an endometrial-like tissue, grows outside the uterus. So this is what happens. The uterus has three main layers. We have the endometrium, which is the layer that basically sheds off during the normal menstrual period. And then we have the myometrium, which is the muscular tissue of the uterus. And then we have the perimetrium, which is the outer layer of the uterus that covers the uterus. Now, what happens is the endometrial tissue, which basically sheds off every month when you don't get pregnant and sheds off as the normal monthly period, is supposed to be only found in the inner lining of the uterus, but then you end up getting this tissue outside the uterus. So you can either find it in the muscular part of the uterus, or you can find it in the fallopian tubes, or you can find it in the ovaries, or you can find it in the pelvis, like in the bladder. You can find it maybe in the anal region, like the rectum. You can find it in severe cases. You can find it even in the lungs or around the navel. So you can find it anywhere else. So when you find the endometrial tissue, which is supposed to be in the uterus, you find it outside the uterus. That is what we call endometriosis. Now, this tissue responds to the hormones that women produce, that's estrogen and progesterone. Now, with that response, it means then it can actually bleed, causing inflammation, scarring, and even adhesion formation. Now, around 6 to 10% of women in their reproductive age will be affected by this condition, and mostly it affects women between the age of 25 to around 35 years. And around 50% of these women who end up with this condition will actually become infertile. So when you look at those people who are infertile, around 50% will basically have endometriosis. And then it is also known to have a family. It's basically known to follow family history. So if one of your family members, either your mother, had endometriosis, it's highly likely that also you might actually develop endometriosis as well. Now, there are several theories that have been explained in different quarters on how endometriosis basically comes to existence, that I will not be able to dive into today. But basically, you can just go ahead and have a look at them, like the retrograde menstruation, coelomic metaplasia, and all that, Now, who are the people who are at risk? So, number one are the people who, or women who have early menarche. So, menarche is the time when you start menstruating. So, early menarche means basically started menstruating below 12 years. Okay, or people who end up having short menstrual cycle. Okay, below 27 days. Okay, we say that menstrual cycle starts from 21 days all the way to 35, depending on how regular someone's menstruation is. So this patient basically will have their menstruation below 27 days. And then patients who have heavy menstruation, okay, or patients who are nulliparous, okay, who have never given birth, okay, or a family history of endometriosis, okay, or patients who are born with low or BMI, okay, or patients who have low BMI, and then patients who have been on prolonged estrogen exposure, especially patients who have been using estrogen-only pills, okay, they are at an increased risk of developing endometriosis. Now, where do you find this endometrial tissue, or where is the common sites where you can find this endometrial tissue? So we have the pelvic, okay, so organs around the pelvic region, and then extra pelvic organs. Like for example, you can find endometrial tissues in the ovaries, okay, which basically when you visualize them under an ultrasound, they will look like chocolate cysts, okay. Or you can find endometrial tissues around the fallopian tubes, or endometrial tissue around the uterosacral ligament, and actually around the pouch of Douglas. For the extrapelvic sites, you can find endometrial tissue on around the bowel, okay, or the intestines, or even in the bladder, okay, or in the lungs, or in the even the surgical sites. You had a procedure where there was a surgery that was done. So around the sky, you can actually find endometrial tissue, or even around the umbilicus. Now, how do patients present? So they will present with increased pain, especially during their menses. So they will have increased dysmenorrhea. Okay, so the pain basically keeps on increasing every time they have their menses. Okay, they will also have dyspareunia. So dyspareunia is basically pain when on sexual contact. So every time they have sex, they will be feeling pain, or they will present with dyskinesia. So dyskinesia basically dyschezia, okay, so basically is pain on defecation. So they will feel pain when passing stool, or chronic pelvic pain, or even pain when passing urine. Now, some of these patients basically will present with infertility. We said around 50% of patients who present with infertility basically have endometriosis. And then, so they can either present with infertility or subfertility. So infertility is when you have, these patients have never been pregnant before, and subfertility is when they had given birth before, but then now they are struggling to conceive. And then their menstrual history will be irregular, heavy, and painful. Now, what are some of the complications that are associated with endometriosis? So, number one is infertility, okay, 50%, okay, chronic pelvic pain, and then we talked about the ovarian cysts and rupture of the ovarian cyst. And then you can have bowel and urinary obstruction. So especially when you get this endometrial tissue in the bowel, or even in the urinary system, you will end up with obstruction. And there is the psychological impact that comes with endometriosis. This kind of pain, every time you near your menstruation and you know how painful it becomes, then it actually causes a lot of psychological impact. Now, how do you make a diagnosis? Of course, a good history and physical examination, very important. These patients, we say they will present with progressive dysmenorrhea, or pain during their menses, chronic pelvic pain, and they will also present with infertility. When you do the examination, you can find some pelvic nodules, okay, or masses around the adnexia region, or some fixed retroverted uterus. So under normal circumstance, the uterus is anteverted. So if this is the bladder, the uterus will be anteverted like this. But then this time round, it is retroverted and it is fixed. Okay. Now the first test that you can do for this patient basically is an ultrasound. The ultrasound will be able to demonstrate the ovarian cysts. Okay. But then especially for superficial lesions, but then for deep lesions, you might need to do an MRI, but then the gold standard for diagnosis is a laparoscopy, so visualization of these lesions. Now, staging of endometriosis, you can stage endometriosis from stage 1 all the way to stage 4. So for stage 1 is just some few superficial implants, okay? Stage 2, you have more implants but with some shallow lesions. And then stage 3 is when you have multiple deep implants that basically end up forming some cysts and adhesions. And then stage 4 is when you have large cysts, okay, with extensive adhesions and depletions. Now, how do you manage? So management of endometriosis is dependent on the severity. It's also dependent on the desire for fertility, okay? And then it also dependent on the age. Okay, so for mild endometriosis, basically these patients can benefit with from painkillers like non-steroidal anti-inflammatory drugs. Okay, but then we say that these lesions basically respond to hormones. So basically, you can give antagonists of those hormones. Okay, like OCPs or oral contraceptive pills. You can give progestins, okay, or the gonadotropin releasing hormone in agonists and antagonists like danazol, okay, that can really help. Now, for patients who desire to get pregnant again, okay, so basically you can do surgical management, which is laparoscopic excision. So you go ahead and laparoscopically excise those lesions, cut them out, or you ablate, okay, so ablation of those lesions. But then for patients who have reached their family size and they do not want to get pregnant again, you can go ahead and do hysterectomy, where you go ahead and basically remove the uterus. Now, for patients who desire fertility as well, you might basically, because of the infertility, you might need to basically do assisted reproductive procedures. Now, what is the prognosis? We say that endometriosis is a chronic and a recurrent condition. Okay, and symptoms basically improve after menopause because the hormones that are responsible for the pain and the bleeding and all that basically reduce during menopause. And then recurrence for this condition basically is around 20 to 40 times after 5 years, even after a surgical procedure. So for patients who undergo a surgical procedure like laparoscopic ablation or excision, they might actually have recurrence of this condition, okay, and around 20 to 40% basically might recur. Okay, and basically fertility improves with early treatment of this condition. Now, if you have found this topic very helpful, please consider subscribing to my YouTube channel. You can also follow me on TikTok. And please comment, share, and subscribe so that this information is able to reach to many people who might benefit from it. Until next time, God bless.